It's already a conflict of shocking numbers, and now a new one is casting a shadow over Gaza. 21,000 children, 21,000. That's how many are missing in Gaza since Israel's offensive began in October. The number has come in a report by the humanitarian group Save the Children. Those numbers made up of those believed trapped under the rubble across the Strip, separated from their families, lost or even detained. In Gaza, the head of the ambulance services has been killed in one of the latest Israeli attacks, along with another health official. They were caught in a strike on a clinic. More than 500 medical personnel have been killed across the enclave since October. Hours earlier, the main building of the UN Agency for Palestinian Refugees was struck, killing at least 8 people. And Israeli Prime Minister Benjamin Netanyahu has made it clear that he's not ready to allow Palestinians to run Gaza after the war. In his first Israeli television interview since the war began, he said intense fighting in southern Gaza is coming to an end, but vowed that the war will continue. Ashraf Shannon joins me now live from Khan Yunis for more. So Ashraf, let's start off with this attack on the UNRWA center. What more can you tell us about that particular attack?
Well, if not yesterday, Israeli fighter jets attacked the entrance to the UNRWA headquarters in the center of Gaza City, killing at least 8 people, including women and children. This is not the first time that Israeli forces attack UNRWA facilities. They have done it dozens, maybe even hundreds of times since the beginning of the war. The attacks include attacks on schools, attacks on UNRWA clinics, attacks on UNRWA facilities. So this wasn't an isolated incident, and overnight they also attacked another health facility that belongs to the Palestinian Ministry of Health, killing 2 people, including the head of emergency medical services in the Gaza Strip. Since the beginning of the war, and this is according to the Palestinian Ministry of Health, more than 500 medical workers have been killed, including doctors, nurses, paramedics, and other health workers in the Gaza Strip. And this is not even mentioning the attack on ambulances. Hundreds of ambulances were bombed and destroyed since the beginning of the war. Since day one of the war, Israeli military has made it there was systematic attacks on the health sectors and also on the civilian infrastructures of the local government and even international agencies,
Right, and we are hearing from the Israeli Prime Minister Netanyahu saying that, the intensity of the attacks are going to decrease, particularly those in Rafah, indicating that they might be going into the 3rd phase of this war. Any indication of that on the ground?
Well, it's like the opposite. We've seen ramping up of Israeli attacks and also an increase in the volume of destruction, torching of homes, bombing of homes, and also demolition of entire city blocks, for example, in Rafah. Over the last few days, TRT World visited those areas that were destroyed by the Israeli attacks since the beginning of the war, and this is what we saw.
Israel's attack on Gaza has caused mass destruction of the territory and will take decades to rebuild. According to the UN Environment Program, an estimated 39 million tons of debris have been generated by the Israeli conflict. For each square meter in the Gaza Strip, there is now more than 107 kilograms of debris. Clearing the wreckage will be a massive and complex task, which needs to start as soon as possible.
Our homes were destroyed and all the infrastructure in our city was destroyed. Look around you. We are living in hell, and I can't even imagine how all this debris will be removed or when will our homes be rebuilt again. We demand an immediate plan to rebuild our homes and our livelihoods. The destruction is unprecedented, and it is very hard on us and our families.
According to Gaza's government media office, at least 370,000 housing units in Gaza have been damaged, including 79,000 destroyed completely, along with commercial buildings. The United Nations estimate for the overall reconstruction of Gaza is between $40 billion and $50 billion.
My neighborhood was completely destroyed, and it looks like it was hit by a nuclear bomb. I think it may take more than 10 years to remove the rubble and rebuild our city. Khan Yunis was completely destroyed like other cities in Gaza. Some of the homes that were destroyed during the 2014 war have not been rebuilt yet.
Due to Israel's attacks, the infrastructure and basic services have been collapsing daily. The scope of damage and destruction in this small territory of around 363 square kilometers, which was previously home to 2 million Palestinians, is unprecedented and still continuing as the onslaught rages on. Ashraf Shannon, TRT World, Gaza.
I'm now joined by Jonathan Fowler. He's a senior communications manager at UNRWA, the United Nations Relief and Works Agency for Palestinian Refugees. He joins me live now from Cairo. Thank you so much for being with us on the program. First off, let me get your thoughts as UNRWA loses another one of its employees due to Israeli attacks.
We tragically, over 190 of our staff have been killed. Gaza is the most dangerous place in the world to be a humanitarian worker. Most of the victims, sadly, of this war in terms of humanitarian workers are local staff. These are people from the community, serving the community of which they are part, and they are paying the same price in blood.
Right, and they play an important role in bringing that much needed relief and assistance to the people that are enduring these extreme conditions. Our correspondent mentioned that more than 500 healthcare workers have been killed in Gaza since October. What kind of an impact is this having on not just the healthcare system, but generally overall across the Strip to people who need that much needed assistance?
Well, just to give you an example, UNRWA is one of the most significant international healthcare providers in the Gaza Strip. We were running 24 clinics, primary healthcare clinics, before the war. Now, only 6 of those are operational, more or less, and that means there's a huge impact on the ability for people to get healthcare. And the clinics that are operating are undersupplied with drugs and other equipment because it's just impossible to get the right amount of aid in to supply them properly. And so this means that the risk of epidemics, of rampant impacts of non-communicable diseases, things like cancer and so on, that's just increasing as time goes by in this war. People are not getting the healthcare that they need.
Right, and just give me your assessment right now of the risk facing people in Gaza with, as you mentioned, the humanitarian catastrophe they're facing. And we do know that they don't have access to enough food and little to no water, which is very important, drinking water.
Precisely, and of course these have huge impacts on human health. I mean, if you don't get enough to eat, then malnutrition ensues, and that makes you more vulnerable to other conditions. And then the lack of clean drinking water means that the increase in waterborne diseases for people who are already vulnerable because of lack of food, I mean, that's just huge. Things like diarrhea, for example, which is a killer, particularly for children. And so we're just seeing a series of more and more medical disasters, and that's not even talking about the trauma injuries that people are facing, the level of war injury that the population is suffering from, and the inability to provide adequate surgery and so on. So overall, I mean, these huge impacts on the health sector, but also the lack of food supply, the lack of water supply, the fact that sewage systems, pumping stations are no longer able to function properly. All of this is just paving the way not only for the current humanitarian disaster, but actually for this disaster to continue when, as we hope, the guns fall silent. And there has to be a ceasefire immediately. But the aftermath is going to be immensely complicated in terms of human health, reconstruction, and all the other things that need to be done.
All right, Jonathan Fowler, thank you so much for being with us here on the NewsHour and sharing your insights with us. I appreciate it.